I did my poster on the gastrointestinal system. The gastrointestinal system includes the mouth to the anus. Most pathological diseases in the GI system are detected through the use of contrast media in the radiology department. The three pathologies I chose are tracheoesophageal fistula, gastroesophageal reflux disease, also known as GERD, and volvulus. Tracheoesophageal fistula is a congenital type that happens in the esophagus. Congenital means it was present at birth. Congenital tracheoesophageal fistulas result from the failure of a satisfactory esophageal lumen to develop completely separate from the trachea. The lack of development of the esophageal lumen resulting in a blind pouch describes congenital esophageal atresia. These fistulas are often associated with other congenital malformations involving the skeleton, cardiovascular system, and GI tract. Type 3 is the most common tracheoesophageal fistula. In type 3, the fistula consists of an upper segment that ends in the blind pouch at the level of bifurcation of the trachea or slightly above it, and a lower segment attached to the trachea by a short fistulous tract. There is a radiographic demonstration of the looping of a small esophageal feeding tube indicates that the proximal esophagus ends in a blind pouch. The treatment for tracheoesophageal fistulas are immediate surgical repair keeps the infant from dying of starvation. If the fistula exists, delayed surgical repair may result in aspiration pneumonia. Gastroesophageal reflux disease describes any symptomatic condition or structural changes caused by reflux of the stomach contents into the esophagus. Alcohol, chocolate, caffeine, and fatty foods tend to decrease the pressure of the esophageal sphincter, allowing reflux to occur. Regardless of the cause, it produces burning chest pain that may stimulate into heart disease. Reflux esophagitis develops when the lower esophagus sphincter fails to act as an effective barrier to the entry of gastric acid's contents into the distal esophagus. Several radiographic approaches have been suggested for the demonstration of GERD. One procedure to increase intra-abdominal pressure by straight leg raising or manual pressure on the abdomen, often with Valsalva maneuver. Having the patient turn from prone to supine or vice versa may demonstrate reflux of the barium from the stomach to the esophagus. The earliest radiographic findings in reflux esophagus are detectable on double contrast studies. They consist of superficial ulcerations or erosions that appear as streaks or dots on barium superimposed on the flat mucosa of the distal esophagus. In single contrast studies of patients, the outer borders of the barium-filled esophagus are not sharply seen, but rather have a hazy, serrated appearance with shallow, irregular protrusions indicating erosions are of varying length and depth. The Valsalva is the last pathology I put on my poster, and that means it refers to a twisting of the bowel on itself that may lead to intestinal obstruction. Because twisting of the bowel usually requires a long movable mesentery, volvulus of the large bowel most frequently involves the cecum and sigmoid colon. The transverse colon, which has short mesentery, is rarely affected by the volvulus. A sigmoid volvulus, more commonly found in elderly, result from a low-fiber diet causing constipation. Cecal volvulus involves the ascending colon. The cecum may have a long mesentery as a fault of rotation and fixation during embryonic development of the gut. In the cecal volvulus, the descended cecum tends to be displaced upward and to the left, although it can be found anywhere within the abdomen. A BE exam is usually required to definite confirmation of the diagnosis. A sigmoid volvulus is a long redundant loop of the sigmoid colon, can undergo a twist on its mesenteric axis and for a closed loop obstruction. In the sigmoid volvulus, the greatly inflated sigmoid loop appears as an inverted U-shaped shadow that rises out of the pelvis in a vertical or oblique direction and can even reach a level of the diaphragm. A barium enema exam demonstrates an obstruction to the flow of contrast material at the site of the volvulus and considerable distension of the rectum. The lumen of the sigmoid tapers toward the site of stenosis, and a bird's beak appearance is produced. The barium enema may be therapeutic and resolve the obstructions. That concludes my poster. The questions are attached below.